the legislative representation, but also state agencies, as well as, most importantly, the general public, to be able to kind of voice their thoughts and vent their frustration and sometimes angry feelings in regards to the annual rate increase meeting that we have. Now, look, in my written testimony, not to belabor it, that I've submitted in writing, I've asked for this panel to reject or significantly reduce the rate request increase and give a voice, and in my documentation, to so many of the people that feel as though they don't have a voice, that feel as though that it is a game in which they have no choice and they're forced to choose between putting food on the table, mortgages, versus providing critical health care for their loved ones. And it is really important for the public to feel as though they have an opportunity. This hearing allows that. But it's important to recognize that in my testimony and my request is to ask this panel to reject and, or if not, significantly reduce your premium request. Now, as I say that, I'm going to approach the insurers, which I've got the chance to interact frequently. You have a very tough job to do. You're certainly not in many holiday lists with some of the things that you have to make in decisions and rate review cases. But I want to acknowledge you for doing business in Connecticut, and also for being an employer and an economic contributor to our state. When we're looking at 3 companies providing in individual and small business group in health insurance in the state of Connecticut, you're one of the few standing. When we look at Florida, which has nearly 16 providers doing business, and you look at Georgia, that has approximately 8 to 9, we're seeing an attrition of people wanting to do business in the state of Connecticut. So I'm going to pivot. I've written my testimony and addressed the issue of why we want you to be able to be more cost effective. But I'm going to change and pivot by asking the fact that one fact stands out. In the state of Connecticut, and as well as in this country, healthcare costs is clearly misunderstood. We have one of the highest costs in this country, if not in this world, in Connecticut. That being said, we also have world-class innovation. We have concerns of an ecosystem. We have hospitals here, we have PBMs, we have insurers, but you deal with medical providers, you deal with issues in regards to hospitals, practices, and malpractice issues, and medical devices. So there's such a comprehensive, complicated system that many people don't understand and maybe not even have the patience to read your actuarial requests and reports. I have read it sometimes, and it's sometimes very mind-numbing. But that being said, most consumers who are angry at you do not fully understand the exorbitant cost of healthcare delivery in this country and in Connecticut. So that being said, I want to ask in regards to a key question for the insurance department panel that's going to make the decision, that should they reject your increase or significantly reduce it, what would your decision be in staying in business and providing individual and small business health insurance to Connecticut residents?
Yeah, I mean, from Anthem perspective, I mentioned this in my opening, we've been around for 90 years in the state, providing coverage for all of our communities, and that includes all various number of segments. We are very much committed to remaining in the market. We would have to look at what happens depending on what comes out of this. At the end of the day, we are a business. We can't sustain losses year over year if that were to be the case. But at this point, we remain fully committed to the communities here in Connecticut and anticipate that we will continue participation in both the individual and small group market segments.
Yeah, and we have been here for 45 years. It's our 45th anniversary this year. So, at the end of the day, and even under law, we have to get adequate rates. I mean, that's what the law states. And so, we have no intention of going anywhere, and we are confident we will get adequate rates in order to pay for the underlying costs of care.
Yeah, and we also want to continue to serve our members in Connecticut, have a lot of desire to do so. One thing I would bring up is that simply suppressing rates does not suppress medical costs. And I think that's a really important thing, because I think that often the rates get suppressed. And as I mentioned on the call, that doesn't really reduce medical costs. It just puts more burden on insurers, and that causes them to make difficult decisions, which we've clearly seen in this market in recent years, with them going from 4 carriers to 2 carriers. As others have mentioned, it's something we need to consider, but we at this time are completely committed to remaining in the market and want to do so as long as we possibly can.
Well, thank you for that frank answer. And it is a stark economic reality that you can't sustain losses. And the medical costs, as I mentioned earlier, is something a lot of people do not fully understand. That being said, how can we as a legislative body, I mean, I will offer this, from the administration on down to Senate and the House, it is truly a bipartisan collaboration to address reducing healthcare costs in Connecticut. We've tackled the PBM issues, we've looked at benchmarking, we looked at a lot of the critical issues. But one of the interesting parts is you compare to Florida and to Georgia. For example, in United Healthcare, you are in the individual business in Georgia, but you choose not to engage in that business in the state of Connecticut. What is the difficulty? What are the challenges in Connecticut? And following up on that, for us in the legislative committee, we looked at some real solutions. And to be able to offset some of the costs, I'd like to get your thoughts on Association Health Plan as an alternative to help you reduce costs and provide critical insurance to needed small businesses and individuals. And the second part is, in Georgia, they utilize the federal 1033 reinsurance program, and your individual costs are significantly reduced as compared to Connecticut. Those are 2 critical issues that have been brought up many times. With those possible solutions, and we're looking at solutions, all right? We're not just simply saying no, 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 but we're trying to find solutions to help you work with us as legislative counsel and the insurance department to deliver critical needed healthcare insurance. But so could you address that first in regards to why United is doing business in the individual marketplace but choose not to do it here in the state, but also 1033 reinsurance programs and association health plans that would be a tool to help you reduce your cost in regards to rates and delivery of insurance?
Mike, you want to take the first part, and I'll take the second part?
Yeah, I can start anyways, and then feel free to jump in whenever. I think obviously Connecticut is a challenging market. We're typically limited on our risk margins, which makes it challenging. And I think that there's other aspects that have remained, that have caused the decision to remain to stay out of the individual market at this point. My focus is on small group, and I'm not as familiar with the individual decisions as our separate individual team. But from my perspective, the solution here is really what you mentioned and what the commissioner mentioned, and that's really just working together and meeting as often as we need to really work this out together. I think the commissioner mentioned at the beginning that this isn't something that the insurers can solve on their own. We really need help from others, and I think it's really working together that's going to get us to solve this. And Eric, please feel free to jump in and add anything I
don't know.
missed.
Just on the association health plan side, I'll go back to what Mike said earlier. You know, this is not a rate problem. It's a claim problem, right? That's driving the rates. So the association health plan doesn't necessarily do anything to solve that. It maybe adds some instability to the market, but doesn't necessarily do anything to solve those claims.
Yeah, and we're now in the individual market, partnering up with Access Health CT and the Covered Connecticut program. So we don't really have a dog in the fight with respect to association health plans because they don't cover individuals. There is an ICHRA program that we have here in Connecticut where employers can pay a subsidy to their employees and they can go to the exchange and get an exchange policy. So I think that is a nice solution, and people should look at that as an alternative to potentially association health plans as well. I could also say there are some adjustments we can make to the Covered Connecticut program. Right now, Covered Connecticut program provides coverage across the entire country. So you can have someone go to a provider outside the state of Connecticut, and they get coverage. And so I think we can tighten that up. So there's other variations we could do, slight changes that I think that can improve the program over time.
Yeah, and I would agree on the Covered Connecticut program. There's a lot of concerns there. People can come in and out whenever they want. And, frankly, the member education, while we can do as much as we possibly can as an insurance carrier, I think there's a lot of work to be done there. And that's not just for the Covered Connecticut population. That's for everyone in this room, everyone outside this room, everyone across this country. You kind of said it, Senator, like the educational aspect of people not understanding what all of this means is a real problem. And I think that starts school systems, that starts in a workplace. You need to educate people about healthy eating habits. You need to educate people about the services and resources that are out there and available to them. So I think it does start there. As far as the association plans or any ICHRA, we're open to any and all of that. At the end of the day, we're looking for optionality for our customers, and if they have more options, I think that makes them a lot more comfortable and a lot more aware of what is available to them.
No, I appreciate all of you answering that, and it's helpful for us to work with you in addressing solutions. And sometimes the federal government imposes some of the mandates, which is out of our control. The last question, if I may, Commissioner, is there's been many conversations in regards to a Connecticut public option, a state-funded program. We have the partnership program that has been in existence. To me, as a committee member in a leadership role, we have seen that being subsidized by taxpayers with risk management and shortfalls. Now, there is talk about being able to expand that program in a much more comprehensive and universal application. So to you, could you share in regards to what the real marketplace is and challenges of what the public option, a single payer system, which seems so very alluring for many people that struggle with your rates, but what the real issue in regards to cost of delivery of services and fully understanding the risk management. We are the Connecticut that is quoted as the insurance capital of the world. We have one of the finest insurance departments in the country. But that being said, we're finding more and more the fact that we don't have companies that want to do business, as I mentioned earlier. But the idea of the public option, a single payer system, is very alluring. But I have not seen government to be a very strong understanding of risks from Mr. Hwang and the very great people at the insurance department. Healthcare cost is unsustainable in itself and is extremely expensive. But the idea of a public option has a panacea to solve all the rate increases and the unaffordability. What is your comment relating to how you would view the public option?
Senator, if I could just interject for a moment. We are talking about the rate filings. We're not talking about other solutions here. I think it's a very important conversation, and I appreciate you bringing it up. I welcome the members to say whatever that they would like to say on this, but I would suspect that these might not be the individuals from the companies that would be able to offer that comment.
Thank you, Commissioner, and then I appreciate that clarification. I think the key is the implication on rates. But that being said, I will defer to you, and if anyone will answer that, I would really appreciate it. But thank you, Commissioner.
Yeah, I mean, I'll give a brief response. I think every one of us insurance carriers in this room do a real service to our community by doing the things that we do. So, I mean, when it comes to case management, I gave my example in the opening, like we're impacting real people's lives and making sure that they are getting the appropriate care that they need. It's a complex system, and I have to go back to education. What would a public option look like if the insurance carriers weren't doing what we do today? That's my biggest fear, is that the services that we provide would be lost in that equation. So that's my biggest concern about the whole thing. My preference would be to work collaboratively with everyone in this room and beyond to come up with real solutions that make sense for our communities.
And I'll just say that, there are some states who have tried something like that, and it just hasn't worked out very well. They just can't control cost, and it hasn't turned out to be the solution they were looking for, and a lot of the costs simply were set upon the taxpayers of that state. So we don't think it is a viable solution.
I'd like to just echo those comments, but also express a willingness to continue to be part of the solution and partner with the state of Connecticut to try to preserve our healthcare infrastructure and make sure that whatever is done does not have the unintended consequence of putting additional strain on an already strained system. So I think it's a holistic approach, and open to continue to partner with the state to come up with real solutions.
Thank you, Commissioner. I just wanted to also close by saying that my legislative colleagues on the Insurance and Real Estate Committee, the chairs and the ranking, have worked very, very closely and collaboratively, and we're really appreciative of your work and former Commissioner Mace's work. So we stand ready to work with you to address these solutions, because ultimately this hearing and many others in previous years have shown that annual rate increases in double digits are unaffordable and unsustainable for many Connecticut residents and businesses. So thank you very much, Commissioner.
Thank you for your comments.